problem, and some types of joints are explained by B. First is Emphathrosis Joint. In Emphathrosis Joint there is a less movement, and examples of Emphathrosis Joint is tibiofibular joints and pubic symphysis, which is present in hip joint. And second type is Diarthrosis Joint, which have full movement that can rotate freely. For example, ankle joint, knee joint and shoulder joint. Third one is Synarthrosis Joint. They have slightly movement or no movement. And its examples are sutures, teeth and sternocostal joint. These joints are mostly present to protect internal organs. And fourth type is Synchondrosis Joint. In Synchondrosis Joint, there is a presence of cartilage and there is no movement in these joints. And examples of these joints is epiphyseal plate and first sternocostal joint. Last type is Syndesmosis Joint, in which there is involvement of. I explain about shoulder joint. Shoulder joint is also known as freely movable joint, and it is also known as weak joint because head of humerus is 4 times greater than glenoid cavity. Some important features are present that give strength to the shoulder joint. First one is coracoacromial arch. Second one is musculotendinous cuff. It is a thick muscle that strengthens the shoulder joint. Third one is glenoid labrum. Fourth one is atmospheric pressure. Fifth one coracohumeral ligaments, and last one is transverse humerus ligament. Then capsular ligament also protects the shoulder joint. Capsular ligaments is divided into 3 parts: medial, lateral and anterior. And anterior parts of capsular ligament further divided into 3 parts: superior, medial and inferior. Superior, medial and inferior parts of anterior part of capsular ligament make glenohumeral ligament. That's why, due to presence of this ligament, it is also known as glenohumeral joint and also called shoulder girdle. In diagram, I explain shoulder joint is made up of acromial process of clavicle, coracoid process of scapula, glenoid cavity and humeral head of humerus.
My name is Aisha and now I will discuss about the fracture of shoulder joints. Now the first fracture is dislocation of shoulder joint leads damage to axillary nerve. The first fracture is frozen shoulder. It is synovial membrane stuck together and that restrict movement. Now the second one is common dislocate congenital joint. It is hip joint, less than 5 years age, more chances of dislocation, and it about 10 to 20 years coaxa vera. Now the third one is arthritis. It is more than 40 years of age. And now the fourth one is arthritis. It is called inflammation at hip joint. And now the fifth one is avascular necrosis, injury at head of femur. Now I will explain frozen shoulder in diagram. In frozen shoulder there is a pain, feeling of pain and stiffness in joint. And this is shoulder capsule. Caps are inflamed due to shoulder movement restriction. Next one is Shenton's line. It present at upper border of obturator, foramen to lower bone, border of neck femur. And the next one is talus. It is no connection with anyone. And neck joint, it is a process called hanging in neck. Fracture and separation of dents, cervical vertebra, axis C3. Transverse ligament ruptures, ligament of atlas that stabilize dents with C3.
Assalamu alaikum. My name is Ariba Saji. Today my presentation topic is joints. Joints is the area where 2 or more bones meet and allow movement. Cartilage is the tissue that covers the bone at joints. There are 3 main types of the joints: fibrous joint, cartilaginous joint and the synovial joint. Now I will tell you about the third type of the joint, which is synovial joint. It is present in the synovial cavity. This is the most important joint of the body and they are freely movable joints. There are 7 types of the synovial joints. First one is the condylar joint. It is present in the knuckle at first metacarpophalangeal joint. Second one is the saddle joint. It is Saddle joint, it is present at first metacarpophalangeal joint of the thumb. Third one is the ellipsoidal joint. It is present at the wrist joint, first metacarpophalangeal joint. Now the next one is the pivot joint. It is present at the radioulnar joint. Next one is the hinge joint. It is present in shoulder and hip bone. Next one is the ball and socket joint. It is present at the knee, ankle. And the last one is the plane joint. It is sternoclavicular joint. There are three types of the hinge joint. First one is the tennis elbow. Forceful extension causes pain at the lateral epicondyle of the humerus. Now the second one is the golf elbow. Cause pain at the medial epicondyle of the humerus. And the last type of the hinge joint is the student elbow carrying angle of the 5 to 50 degrees. Show you the synovial joint. This is the synovial cavity which contains synovial fluid. The inner layer is made up of the periosteum and the outer layer is made up of the fibrous capsule. And synovial joint is also known as the freely movable joint of the body, and it is the most important joint of the body.
Start.
Now the second one is cartilaginous joint. It have cartilage between the joints. It is present between epiphysis and diaphysis of the bone. For example, intervertebral disc, there are two types of the cartilaginous joint, primary cartilage joint and the secondary cartilage joint. First of all, I will tell you about the primary cartilage joint. It have no movement, for example, epiphysiodiaphyseal joint, and then I will tell you about the second cartilage joint. It have little and slight movement. It is present between vertebral disc and the epiphysis. Now I will explain all the joints one by one. First of all, I will tell you about fibrous joint. It is present between the bones. It have fibrous tissue. The example of fibrous joint is suture joints, and it allow no movement.
Today our topic is joints and its types. Now I can explain the ligaments. What is ligaments? It's a fibrous connective tissues that contains two bones together. It is made of the type 1. And next one is type of ligaments. How much type of ligaments in our joints? These are two types. Number one is dense and number second is elastics. In the dense, it's present in the elbow and hip joints, and but the elastic is present in the ear and vertebrae and fats. Next one is the connective tissues. What is the connective tissues? Connective tissues which are present in our joints, which makes muscles together, and it's are two types: fibrous connective tissues and rigid connective tissues. Fibrous connective tissues tends and ligaments, but the rigid connective tissues contains cartilage and bones. Further is the explanation of the function of ligaments. What is the function of explanation? You know that every organ have node and functions. Due to without its functions not contain any muscles and any joints work properly. So it's have also a favor and greatest function of the ligaments is that stability and viscoelasticity. Stability is that we move and things, and elasticity is we rotate and any function of the ligaments due to help of the. Now we can explain the tendon. What is tendon? Tendon is a stronger connective tissue in our body that connects muscles with bones, and it covered from the synovial sheath where connective tissues fibers partially arranged that increase the tensile strength of the tendon. Next one in the tendon is the bursa. What is the bursa? It is the strongest extremity and feed the sacs connected from the synovial sheath, which is that is the F1 sacs filled with the sacs connective tissues. Next one tendon is the housemaid's knees. What is the housemaid's knee? It is the where the inflammations of the parietal bursa is present, is known as housemaid's knees. And in what is the rise? Rise mean the R mean rest, I mean eyes, and C mean comparison, and E for elevations. Rest, eyes, comparison, elevations. Now one is the cartilage. What is the cartilage? It is present in the type 2, and in type 2 it has formed in further in the C1, C2 and C3. C1 is the function of the bones, ligaments, skin, hair and nails. C2 is the cartilage, nucleus pulposus, cerebral ulnas and retina, and C3 is present in the hollow organs like as blood vessels and uterus and so on. In the types of the cartilage, it has three types of the cartilage. Number one is the hand cartilage, number two is the fabric cartilage, number three is the elastic cartilage. Now we'll discuss about the hyaline cartilage. In the hyaline cartilage, it is the present in the epiphyseal growth parts and the ribs, and plus the ribs, and no repair and of the ligaments and lateral life of the after the joints of the hyaline cartilage. Second one is the fiber cartilage. In the fiber cartilage, it is present in the ossifies but repair slowly. Its repair fast, but its repair slowly, and its repair is almost not done. But in the fiber cartilage, it's present in the vertebra and vertebral discs, and it's also present in the medial joints and the synovial joints. Third one is the elastic cartilage. It is also present in the respiratory factories, which is also known as the repairing of the first, and no artery and no organs is present in this, and it is present also in ear and epicondyle formations.